Thank you. Kia ora koutou, ko Kevin Ross aho. I've got 15 minutes to talk to you about health and why I believe it's the sector that has the greatest promise for artificial intelligence and why New Zealand is the most exciting place to do this work. So I head up this organisation called Precision Driven Health. It's a partnership in New Zealand between our health IT companies, our health providers and our universities trying to build this new future. I'm going to talk a little bit more broadly about the sector first and then some of the work we're doing in New Zealand. But let me introduce you to health. So health is about 15 or 20% of our economy, and that is growing faster than GDP. So anyone can do the maths, that's not sustainable. A lot of that's good news. We're living longer, and we're spending a lot more of that time not doing productive work, but enjoying ourselves in retirement and things like that. We're also making it possible through technology to actually live longer, and therefore it's more expensive technology that gets applied to those people later in life. But despite all of these sort of pressures, we still think about 1/3 of all health spending is waste. So what that means is we're spending money on things that are not effective. They're not actually leading to health improvements. And this has a huge range of exactly why that is. In some countries, it's because of the way the system's set up, insurance being an example that you have some false economies, incentivization to do things rather than to make people better. But even in New Zealand, we think this is about true of our state today. We have care that's provided too late when something much more effective could have come much earlier. And again, New Zealand's a great place to actually think about this because with a single sort of government-paid health sector, we actually are in the situation where what's better for an individual is also better for the system as a whole. So some of that waste is easily avoided, some of it's harder to find, but technology has a huge role to play. Unfortunately, health is a really slow-moving beast. It takes about 16 years for a new health practice to actually go from it's been validated to it's actually general practice. It's a very long time scale, and it is the one sector that still uses fax machines and pages. We're in a really conservative moving kind of industry, and it's also somewhat guarded. You see signs like this on people's walls. Don't confuse your Google search with my medical degree. Now, our response to that is, actually, the medical degree is great, Google search is great, surely we can combine them and do something better together, as opposed to thinking of them as actually opposites here. So let's just think about what health actually is. Giving people health advice, in particular, is really a data science. It's collecting a whole lot of information, collating that, using what you know, and giving someone advice on what to do next, or taking some advice and some decisions from that. That data in health is complex. Some of it's clean static data like demographic information. Some of it is very messy data like devices that you're starting to wear and that noisy data is coming through the records today. Some of it's really huge data compared to the rest of your health record like your genome, which is orders of magnitude larger than the rest of your health record combined. You've got data that's very structured, like lab results, and very unstructured, like an image or the letter that a doctor sent in referral from one point of care to another. And actually, that's where a lot of the really key information is in health. It's this person is referring you to a specialist for more care, and they've written that down in a reasonably unstructured way that somehow needs to be understood. The tradition in health is what's called evidence-based care. Someone does a big study, big clinical trial, proves that something's better for the general population, and then they start applying that to the general population. Health is really just moving on from that to something that we think of as precision health, which is targeting the right care to the right individual based on the data that we have about them. We're still a wee way away from what I would call artificial intelligence, where rather than us saying, here's the outcome, here's the data, machine learning kind of find the algorithm that works, actually asking the machines to actually ask the questions and figure out what those questions should be. So we're on a big journey here in the health sector to go from quite a slow-moving sort of change process to something that's really adapted. But if you think about what happens at the core of any of that, all that anyone ever does in the health sector is take some information and figure out what to do with that information. And that's exactly what artificial intelligence does. Just process that information. It turns out that information is more and more digital, and in particular in New Zealand, it's more digital than almost anywhere. We've had single ID numbers for everyone in the New Zealand population in the health sector for about 20 years, which means every record we have in New Zealand, you can confidently tie to which individual was actually given that advice and that treatment. That doesn't exist in most of the world. So we can look back and do longitudinal studies, if you like, of our population much easier than most places, where they're just starting to collect that in a digital form. So let's just think forward a little bit to what health might look like about 10 years from now. I really like this quote from Bill Gates that's been attributed to a few others before that as well, that we tend to overstate what we can do in the next couple of years, but understate what will happen in the next 10. So thinking, first of all, about that sort of 10-year vision, how will healthcare actually be different from what it is today, or how could it be different? And I'll focus mostly on the patient to clinician interaction. And I say clinician quite broadly. This could be a doctor, it could be a teacher, it could be anyone involved in providing advice, it could be family even. So what could that actually look like? What's that likely to look like? Well, first of all, there's a whole lot more data that's being presented to this situation. So our doctors today are given maybe 15 minutes with a patient to give as much advice as they can, and that patient's coming in with more and more information. Things like digital medication are coming, where actually I can give someone a tablet and I can digitally tell whether or not they actually took it or not. Because it turns out under that waste area, medication adherence is a huge issue. We don't actually know who took what medication, even if they were prescribed it. So we're going to get much more information, not just on what they took, but what that actually has done to their body. Then there's all the other monitoring equipment. We wear all these devices now, and we're quite aware of all the sensors. Perhaps we have sensors in our homes that are monitoring how we walk and these sorts of things, especially for older patients that might be living more independently. All that data can become part of the consultation. So we've got all of this data that needs to be translated very quickly to the clinical setting. And if you think about how that actually operates today, studies say that medical knowledge is doubling about every 73 days. So if you think about what we expect our clinician to do in terms of understanding all this data and things, it's absolutely impossible to keep up with what was known yesterday, let alone keep up with the new knowledge. So the AI tools that we have today and in the future need to be basically tools that translate all of the knowledge that's being generated around the world, matching this against the patient that's in front of us and giving it into a very concise, what's the best next step. And so that's why I sort of indicated what currently exists as a bit of a screen or a laptop in the doctor's surgery today needs to become a learning platform. Today, our clinicians don't really like the technology in the room. They spend their time putting stuff in because they have to. They don't love their technology because it helps them do a better job. So we need to figure out how to actually turn this round to, actually, this is immediately giving me something that I can use in this consultation. Real time, based on all the information that's available to me. And going back to what all that data is, essentially what we're always all coming back to here is the question, what do I say to a patient like this? It's not that much different to people like you bought that product. It's people like you this often happened to, or this work tended to work for. So what we need is that sort of learning platform in the room and some sort of assistant in the room. Google's Eric Schmidt spoke last year at the Health Informatics Management Systems Conference about the fact that health is the one industry that really hasn't had the killer app come along and actually really change the industry, and that his view of what that was likely to look at is some sort of an assistant in the room. And we've talked a lot already at this conference about digital assistants. What we need of those is that ability to stop having people have to spend their time typing stuff and record the information other ways, so that the patient and their carer can actually spend their time communicating and being guided by something else in the room. So that digital assistant could play a lot of different roles in terms of guiding the way that a conversation goes. There are many, many other ways. So I've focused on that sort of clinical interaction there. There are all sorts of other places for AI to make a difference. Things like robotic surgery is becoming much more of a feasible opportunity. There's all sorts of things in the sort of the fraud detection and cybersecurity side of health as well. Studies suggest it's about $150 billion industry, just the AI impact in health space of it. But all of this is only going to happen if we actually have a social license to do the work. And I've mentioned that New Zealand has great data. New Zealand doesn't have great consent processes for understanding what's acceptable to use that data for. We know we could do lots of analysis on New Zealand's health records. Do New Zealanders accept that? Many of us are organ donors, and we're quite happy to donate our organs when we die. Would we be happy to donate our data when we die? What about when you're alive? Would you donate your data to a health study when you're alive? We know that people generally do if it's a rare condition that they have that they know others don't. And even when they don't benefit personally, that they can see that them participating in this study might save someone else from that situation that they're facing right now, people tend to say yes. Our problem in New Zealand is we don't ask that question. So one of the challenges I put out to this community is how do we engage the whole public in that question, and how do we build tools that would actually capture that information on what people find acceptable and unacceptable? Because we can talk all we like and have our committees all we like, but unless we actually engage people, we're going to have situations that blow up in our face. And so we need to figure out how to have that conversation at a public level in New Zealand. I love the work that the Data Futures Partnership did in the last couple of years in terms of just thinking about what's that public conversation look like for social license. What questions do we need to ask if we're trying to use people's data for a data science project? Health, again, coming back to current state, actually is the one industry I know where we actually use data less than people assume we do. There's shocking situations where if you get referred from one place to another, the passing of information is literally a PDF document at best that ends up as an attachment in someone's inbox. That's just not good enough. We're in a world where you could do so much with the actual data that's in there and handing over tools to understand people's care that we need to do a lot better in that context. So Precision Driven Health is the organisation that I lead. It's a partnership, as I mentioned before, between a number of parties. We're about 3 years old. We've invested in about 60 projects so far, and we're facing all of the challenges that you'll hear about today. Just to give you one example, we're building a system to try to help prioritise patients who are referred from primary care to secondary care with a heart condition. And using all the data that's available, how do you make sure that you prioritise so that doctors, instead of spending the first 2 or 3 hours of the week going through the documents, they can spend that time with the patients and have some of that automated. Now, one of the things that came up very quickly in this study is thinking about the issues of bias in the data that we're using. So historically, Maori have about twice the rate of heart disease as the rest of the population, yet they're not referred at twice the rate. So what we are not trying to do here is automate something that's happening in the past if that doesn't actually give you the outcomes that you're hoping for. Now, just because that's what's in the data and there's some bias in there in the past doesn't mean you don't do the work. In fact, pulling back from doing the work means basically you're accepting that that bias process should continue. Doing the data science exposes it, and then it presents us with the question. How do we build what we actually want to build here rather than have a system that is either automating what's happened in the past or letting the past continue? So we're facing all these questions in the sorts of projects we're doing. We're really keen to work with others. We're a big network across New Zealand. We're supported by MBIE through the partnership program, which is otherwise supporting sort of primary sector industries so far. This is the first technology example where the government have really got behind trying to create a thriving sector for New Zealand in the technology space. So we're really excited about it, and I'd love to talk to anyone who's keen to be involved. Thank you very much.